Hello, fellow nursing enthusiasts, students, and passionate caregivers. Welcome back to our YouTube channel, your go-to destination for all things nursing. Today, we're diving deep into the world of cardiac care and addressing one of the most critical topics for nurses, myocardial infarction (MI). In today's video, we'll explore a series of challenging nursing questions that revolve around myocardial infarction. I encourage you to take a moment, think about your answers, and then join me as we dissect each question, revealing the answers and the underlying rationale. So grab a notepad, get comfortable, and let's enhance our nursing knowledge together. Question 1. A 62-year-old male patient arrives at the emergency department with severe chest pain, diaphoresis, and shortness of breath. The nurse suspects a myocardial infarction (MI). What diagnostic test should be prioritized to confirm the diagnosis? I. Arterial blood gas (ABG) analysis. B. Chest X-ray. C. 12-lead electrocardiogram (ECG). D. Cardiac catheterization. Answer: C. 12-lead electrocardiogram (ECG). Rationale: a 12-lead ECG is the primary diagnostic test to confirm a myocardial infarction. It provides immediate information about changes in the electrical activity of the heart and can identify specific patterns associated with myocardial ischemia or infarction. Question 2. The nurse is caring for a patient with an acute myocardial infarction. The healthcare provider prescribes a fibrinolytic therapy (TPA). What is the primary goal of administering TPA in this situation? A. To relieve pain. B. To reduce anxiety. C. To dissolve the blood clot. D. To stabilize blood pressure. Answer: C. To dissolve the blood clot. Rationale: the primary goal of fibrinolytic therapy, e.g. TPA in the management of an acute myocardial infarction, is to dissolve the blood clot that is occluding a coronary artery, thereby restoring blood flow to the heart muscle. Question 3. A patient who has experienced enceinte elevation myocardial infarction STEMI has undergone percutaneous coronary intervention (PCI) and stent placement. What medication should the nurse expect the patient to be prescribed after the procedure? A. Warfarin. B. Clopidogrel Plavix. C. Furosemide Lasix. D. Metoprolol. Answer: B. Clopidogrel Plavix. Rationale: Clopidogrel Plavix is an antiplatelet medication commonly prescribed after PCI and stent placement to prevent stent thrombosis and ensure blood flow through the stent remains unobstructed. Question 4. A patient who recently experienced a myocardial infarction is prescribed nitroglycerin. What is the nurse's priority assessment before administering nitroglycerin? A. Blood pressure and heart rate. B. Respiratory rate and oxygen saturation. C. Serum electrolyte levels. D. Pain intensity and location. Answer: A. Blood pressure and heart rate. Rationale: before administering nitroglycerin, it's essential to assess the patient's blood pressure and heart rate. Nitroglycerin is a vasodilator that can cause hypotension and tachycardia, so it's crucial to ensure that the patient's vital signs are stable within an acceptable range. Question 5. A patient is experiencing chest pain and shortness of breath. The nurse suspects myocardial infarction (MI) and initiates appropriate care. Which class of medications should be administered first to relieve chest pain in this patient? A. Angiotensin-converting enzyme ACE inhibitors. B. Beta blockers. C. Opioid analgesics. D. Antiplatelet agents. Answer: C. Opioid analgesics. Rationale: the initial priority in managing chest pain during a suspected myocardial infarction is pain relief. Opioid analgesics, such as morphine, are often administered to alleviate severe chest pain and reduce anxiety in patients with an MI. Other medications, such as antiplatelet agents, ACE inhibitors, and beta blockers, are important components of post-MI care, but are typically administered after pain relief has been achieved. Question 6. A nurse is assessing a patient with a suspected myocardial infarction (MI). Which symptom is most indicative of an MI? A. Nausea and vomiting. B. Epigastric pain. C. Sudden, severe, crushing chest pain. D. Hyperventilation. Answer: C. Sudden, severe, crushing chest pain. Rationale: The hallmark symptom of a myocardial infarction is sudden, severe, crushing chest pain, often described by patients as a feeling of pressure or constriction in the chest. This pain may radiate to the arms, neck, jaw, or back. Question 7. A patient with a history of angina pectoris presents with chest pain. The nurse administers nitroglycerin as prescribed. What is the expected therapeutic effect of nitroglycerin? A. Improved myocardial oxygen demand. B. Increased heart rate. C. Enhanced platelet aggregation. D. Reduced chest pain. Answer: D. Reduced chest pain. Rationale: nitroglycerin is a vasodilator that relaxes coronary arteries, improving blood flow to the myocardium and reducing chest pain angina. Question 8. A patient presents with signs and symptoms of an acute coronary syndrome, ACS. The nurse observes the electrocardiogram, ECG, and notes ST segment elevation in multiple leads. What type of ACS is indicated by this ECG finding? Unstable angina. The non-ST elevation myocardial infarction and STMI. CST elevation myocardial infarction STEMI. D. Variant Prinz-Metals angina. Answer: CST elevation myocardial infarction STEMI. Rationale: ST segment elevation on an ECG is a characteristic finding in ST elevation myocardial infarction, STEMI, and indicates that there is an acute, full-thickness myocardial infarction occurring. Question 9. A nurse is administering aspirin to a patient with a suspected myocardial infarction MI. What is the primary purpose of aspirin in this context? A. To relieve chest pain. B. To lower blood pressure. C. To reduce platelet aggregation. D. To increase coronary artery vasodilation. Answer: C. To reduce platelet aggregation. Rationale: aspirin is administered in the context of an MI to reduce platelet aggregation and prevent further formation of blood clots within the coronary arteries. Question 10. A patient presents to the emergency department with chest pain, and the nurse suspects an MI. Which laboratory test is most specific for confirming myocardial injury? A. Troponin. B. Creatine kinase MB CKMB. C. Myoglobin. D. C-reactive protein CRP. Answer: A. Troponin. Rationale: troponin is a highly specific biomarker for myocardial injury. Elevated troponin levels in the blood are indicative of damage to the heart muscle. Question 11. A nurse is caring for a patient who had a myocardial infarction MI. The patient develops ventricular tachycardia VT. What is the immediate nursing intervention for VT? Administer atropine. B. Initiate cardiopulmonary resuscitation CPR. C. Assess vital signs. D. Administer oxygen. Answer: B. Initiate cardiopulmonary resuscitation CPR. Rationale: ventricular tachycardia VT is a life-threatening arrhythmia that can lead to cardiac arrest. The immediate nursing intervention is to initiate cardiopulmonary resuscitation CPR and call for assistance. Question 12. A nurse is providing discharge teaching to a patient after an MI. What dietary recommendation should the nurse prioritize for this patient? A. High-sodium diet. B. Low-fat diet. C. High-caffeine diet. D. High-carbohydrate diet. Answer: B. Low-fat diet. Rationale: after an MI, dietary recommendations often include a low-fat diet to reduce the risk of atherosclerosis and further cardiac events. Question 13. A nurse is caring for a patient with an MI. Which medication, often referred to as a clot buster, is administered to dissolve the thrombus causing the MI? A. Aspirin. B. Nitroglycerin. C. Clopidogrel Plavix. D. Alteplase TPA. Answer: D. Alteplase TPA. Rationale: Alteplase TPA is a thrombolytic agent used to dissolve thrombi in the coronary arteries, restoring blood flow to the myocardium in patients with an MI. Question 14. A nurse is assessing a patient who had an MI. The patient reports feeling lightheaded and dizzy when sitting up or standing. Which complication of an MI is most likely responsible for these symptoms? A. Heart failure. B. Cardiac tamponade. C. Orthostatic hypotension. D. Ventricular fibrillation. Answer: A. Heart failure. Rationale: lightheadedness and dizziness when sitting up or standing can be indicative of heart failure. a complication that can occur after an MI due to the heart's reduced pumping ability. Question 15. A patient with a recent MI is prescribed beta blockers. What is the primary therapeutic effect of beta blockers in post-MI care? A decreasing blood pressure. B. Reducing heart rate. C. Relieving chest pain. D. Dissolving blood clots. Answer: B. Reducing heart rate. Rationale: beta blockers are often prescribed after an MI to reduce heart rate, lower myocardial oxygen demand, and improve overall cardiac function. Question 16. A nurse is caring for a patient with an MI who is prescribed thrombolytic therapy. What is the goal of thrombolytic therapy in this case? A. To relieve chest pain. B. To reduce blood pressure. C. To prevent further blood clot formation. D. To dissolve the coronary thrombus. Answer: D. To dissolve the coronary thrombus. Rationale: thrombolytic therapy is used to dissolve the coronary thrombus causing an MI, thereby restoring blood flow to the myocardium. Question 17. A patient is experiencing chest pain that is not relieved with nitroglycerin. What action should the nurse take next? Administer a second dose of nitroglycerin. B. Reassess the patient and vital signs. C. Administer aspirin. D. Prepare for immediate defibrillation. Answer: B. Reassess the patient and vital signs. Rationale: if chest pain is not relieved with one dose of nitroglycerin, the nurse should reassess the patient, vital signs, and the need for additional interventions. This is important before administering a second dose or considering other treatments. Question 18. A patient with a history of angina has been prescribed sublingual nitroglycerin for chest pain. The nurse instructs the patient to take 1 tablet sublingually for chest pain and wait 5 minutes. If pain persists, the patient should take a second tablet and wait an additional 5 minutes. If chest pain is still present after the second tablet, what should the patient do? A. Call 911 or emergency services. B. Take a third nitroglycerin tablet. C. Wait for the nurse to arrive. D. Take an aspirin tablet. Answer: A. Call 911 or emergency services. Rationale: if chest pain persists after taking 2 sublingual nitroglycerin tablets, the patient should call 911 or emergency services immediately, as it could indicate an ongoing or worsening cardiac event. Question 19. A patient with an MI is receiving a heparin infusion. What is the primary purpose of heparin therapy in this situation? A. To relieve chest pain. B. To reduce blood pressure. C. To dissolve blood clots. D. To prevent further blood clot formation. Answer: D. To prevent further blood clot formation. Rationale: heparin is an anticoagulant used to prevent further blood clot formation, particularly in the coronary arteries, in patients with myocardial infarction. Question 20. A nurse is caring for a patient with an MI. The patient reports pain that has lasted for 12 hours. Which term is used to describe this situation? Unstable angina. B. NSTMI. C. STEMI. D. Chronic stable angina. Answer: C. STEMI. Rationale: a myocardial infarction MI that lasts for an extended period, such as 12 hours, is termed a ST elevation myocardial infarction STEMI and is associated with full-thickness myocardial damage.